Hi everyone, how are you? My name is Tom Seaman. I'm going to do a video today on dystonia treatments. I have had dystonia, and this is a picture of me to the left here. I have had dystonia since 2001, so 21 years now. And I have gone through some really tough times, and I've also gone through some times where I've begun to improve. And I'm going to share all that with you as I go along here. But this is going to focus a lot on treatments that are available to us because there are many things that people may or may not be aware of that they could try to try and improve upon their symptoms. So I'm going to first talk about what dystonia is for those who are unfamiliar with it, or if you are and you want to fast forward through this, feel free to do that. I'm going to go over the various forms of dystonia. I'm not going to cover every single form, but I'm going to cover the most common. And if I don't cover yours, I apologize at the outset, but I'm going to do my best to cover as many as possible. Then I'm going to talk about dystonia treatments and therapies, and of course, I'm going to talk about what treatments and therapies help me most. So what is dystonia? It's a neurological movement disorder. It's where muscles are involuntarily and uncontrollably contracting and spasming in the body part that's affected, which causes things like repetitive movements, twisting of body parts, and curling of body parts, or abnormal postures, tremor. Some people have just a tremor. Some people have just one of these things, or all of these things, or a couple of these things. It's a highly variable condition, so no two cases are identical. So essentially what happens is there is a co-contraction of opposing muscles. I've talked about this in other videos, and I actually made a video that's called What is Dystonia and What Does It Feel Like, which I'll put a link to below this video, and you can also just search for that if you'd like to. And I go over a bunch of different, it's like a 4-minute video. I go over a bunch of different ways to describe how it feels. So if you want to check that out, please feel free to do that. So these muscle contractions, they can be sustained where they're just constantly they're just constantly contracting, which is the case for me when it was most severe. So my head was locked in that position that I showed you in that first slide. So for me, it was sustained. Now, some people have intermittent spasms and contractions. And like I mentioned, sometimes it will include a tremor or sometimes just be a tremor, which makes it hard to diagnose because tremors exist in other movement disorders like Parkinson's and essential tremor, which are the two more common movement disorders, dystonia being the third most common. It can cause varying degrees of severity. As I said, there are no two exact cases of dystonia. Now, some people may look highly symptomatic while some may show no changes, none of which is an indication of how a person feels on the inside. I know some people that look highly symptomatic, yet they don't feel pain, for example, or maybe other symptoms. And I know some people that look totally symptom free, yet they're experiencing horrific pain and other internal invisible symptoms. So, and everything in between, of course, as well. So how a person looks does not indicate how they're feeling. So please don't judge a book by the cover. It's the third most common movement disorder, as I mentioned before. It's estimated to affect 500,000 in North America and 1 million worldwide. I think these numbers are quite low, but these are the current estimates that are available to us. Now, there are many forms of dystonia which can affect any part of the body. I'll go through a few of those in a little while. The form I have is a focal dystonia called cervical dystonia, which means it affects my neck. Now, focal refers to the dystonia being localized to one body part or region. So for me, it's my neck. It could be for somebody else in their hand or their foot or their arm or their leg or somewhere else. So it's one particular area. So these are the forms of focal or rather cervical dystonia. These are the prototypical 4 different versions. Most people don't have them exactly like this. Some people do. Some people have it as severe as this, or even more severe, or less severe. As again I said before, it's a highly variable condition. Some people have a combination of these different forms, so they don't always appear exactly as you see here, but these are the 4 different forms of dystonia, of cervical dystonia, I'm sorry. And this is how it manifested in me. So I showed you that first picture on the left in the beginning of the slide program. Um, and the one on the right, you can see in both these pictures how intensely contracted my neck and shoulder muscles are. And they were much more contracted than these pictures actually show. I was stuck in these positions, and any kind of movement made it worse. And here I am on the left. I wanted to show this picture because a very common trait for people with cervical dystonia is a raised shoulder on the affected side, because those muscles are contracting and shortening, which pulls the shoulder muscles up and the head and ear towards that shoulder. And on the right, I am so contracted and having so much spasticity, I was having difficulty peeling a banana. So you can see how, even in a still photograph, how intense this can be and the kind of pain it could potentially cause. And for me, it was beyond words severe, brutal pain. So the classifications for dystonia: idiopathic, genetic, and acquired. Idiopathic, that refers to people that don't have a clear cause, and most cases are actually idiopathic, but some people can have a very direct cause-effect relationship where it could be due to an accident or some form of other trauma, and then the symptoms appear right thereafter. Many other cause-effect relationships as well, but that's one example. But I don't know a lot of people personally that actually can say that this happened to me and then boom, I had dystonia. For me, I can point to about 8 or 10 things, all of which are theory. And I think that's the case for a lot of people. There's also genetic forms of dystonia, and that's where people carry a defective gene that they inherit from one or more parents, but it doesn't follow that if you inherit the gene that you are going to actually develop dystonia. And then acquired dystonia, that results from environmental or other damages to the central nervous system. So that could be something that happened at birth, some kind of a birth injury, infections, exposure to recreational and prescription drugs. You may have even seen commercials recently about people who are developing, when they list the side effects in a lot of these different drugs, mainly things for like bipolar and depression, they mention involuntary muscle contractions that may remain permanent or something along those lines. So they're now basically saying that certain medications can actually cause movement disorders, which I'm now hearing more and more and more. You could be exposed to heavy metal or carbon monoxide poisoning. I know someone that was exposed to formaldehyde and they developed dystonia. Trauma, stroke, there's many others as well. So a lot of different triggers for a lot of different people. And these are considered acquired dystonias. The most common forms of dystonia, they're based in the body part or body region that's affected. So we already talked about focal dystonia. Now there's also multifocal dystonia, and that involves 2 or more unrelated body parts. Generalized affects more than one body part or sometimes the entire body, and I'll show you a picture of this, as well as multifocal. I'll show you a photograph of that too. Segmental, that affects 2 or more adjoining parts of the body. And hemidystonia, that involves the arm and leg on the same side of the body, and I'll show you a picture of that too. So again, forms of focal dystonia, because these are the most common. Cervical dystonia, which we already discussed, that's contractions in the muscles in the neck. There's also blepharospasm. This is where it affects the eye muscles. It controls the eye blinks. So usually both eyes are affected, and it can include a variety of things like increased blinking and spasms that may cause the eyelids to close completely or open completely. I know many people that have this, and it manifests in different ways, and certain things will trigger it and certain things will turn it off. A good friend of mine has it where whenever she speaks, her symptoms disappear, but when she's quiet, when she's not talking, they appear. So there's a connection there going on as well. Oromandibular dystonia, another form of focal dystonia. It's also called cranial facial dystonia, and that's where it affects the muscle of the jaw, lips, and tongue, which can cause a lot of difficulty opening and closing the mouth and eating and swallowing and speech as well. And then there's Mage syndrome, and that describes both oromandibular and blepharospasm together when they occur simultaneously. There are also task-specific dystonias where it occurs when a person is doing a certain activity. So they may be symptom-free at rest, but when they do an activity, the dystonia appears. So a couple examples: typist cramps, musician's cramp. there's actually a term called musician's dystonia, which is where people who play an instrument, they will be symptom free until they begin playing the instrument, or people that perhaps sing are fine until they begin to sing, and all of a sudden something happens with their vocal cords. Um, it's a fascinating phenomenon to watch. There's a guy named Billy McLaughlin who has for many, many years, he's a guitar player, a phenomenal guitar player, for many, many years has had musicians dystonia. And he's done so much awareness and work, especially for the Dystonia Medical Research Foundation, a wonderful resource, by the way. So please be sure to check out their website and information as well. He's done a lot of work on their behalf and our behalf. So you might want to check him out too. Again, his name is Billy McLaughlin. There's also spasmodic dysphonia, also called laryngeal dystonia, and that involves the muscles that control the vocal cords, which can result in strained or breathy speech depending on what form you have. And there's two forms. It's adductor and abductor, and I'm not going to go into what those are specifically. There's information you can search to get into all the details of those, as is the case for all the ones I'm listing here. I just want to kind of go over this really quick before I get into treatments. Here is cervical dystonia. So this is where it's affecting, this is a focal dystonia. This is where it's affecting just one body part. This is not me, but my symptoms were kind of like this for a while, many years ago. And then there's multifocal. So here it is affecting two unrelated body parts, in this case, the feet and the hands. So it may be your neck, and it could be your feet, it could be your neck, it could be your hand, it could be anything. It could be any two unrelated, or two or more really, unrelated body parts. So not connected, like segmental where they are connected. Then there's hemidystonia, which I mentioned earlier, where you can see it affects the arm and leg on the both sides, and almost actually looks a bit like cerebral palsy. And then generalized dystonia I mentioned before as well, where it affects the entire body or most of the body. And this is quite a severe case here, but I do know people that are just like this. So you can imagine how intense this must be to live like this with all of your body muscles involuntarily contracting all of the time. And also I mentioned genetic forms of dystonia, and there are a bunch of ones that are known to be inherited or genetic, and one of them, for example, so DYT is the genetic classification system that's used for dystonia. So they're all DYT with a number after it. So for example, DYT1 is early onset generalized dystonia. And then there's something that I also wanted to mention, one other DYT gene, because this is a pretty common genetic form of dystonia called dopa responsive dystonia, or DRD. Another name for it is Sagawa's disease, and that is where people typically experience onset during childhood and they have progressive difficulty walking, and it's a mutation in the DYT5 gene. And this can mimic various forms of spasticity and cerebral palsy and other conditions, and sometimes very much misdiagnosed. Here are all of the different DYT genes for dystonia. I'm not going to go through all these, but I wanted to put them up here in case you're interested and you want to pause the video or come back to it and take a look and check them out. There are actually another page here as well of different ones. So there are quite a few genetic ones. However, genetic forms of dystonia are not as common as the other ones that I mentioned. Now, there is currently no cure for dystonia, so we rely only on treatments and therapies to manage our symptoms. There are some people that do experience a remission, and I do know people that have. I'm not one of them, but it's not very common. But it is possible, so don't hold out hope that that could possibly happen for you if you are living with this condition. But currently there is no cure, as there is really no cure for anything currently. Everything is managed in one way or another. So now let's get into the treatments for dystonia. Now, like symptoms of dystonia, treatments are also highly variable, so there is no cookie cutter approach, and what helps one person may not help another person. So let's start with medications. The first one, the most commonly used one, is called botulinum neurotoxin or chemodenervation, more commonly known by Botox, the most well-known, and then Xeomin, Dysport, and Myoblock. And I just want to make this quick mention here regarding these four. Most people and most people are treated with and know Botox and have for many years now. But some other ones have come across, like Xeomin's, the newer version of this, and it's a different formulation and it is administered a little bit differently. Same with Dysport, same with Myoblock. So I often hear people talking about getting Xeomin, say on support groups, and someone will ask, well, what is Xeomin? And a common response, not always, but a common response is Xeomin is another form of Botox, which is actually not accurate because Botox is a brand name and the company that makes it is Allergan. Xeomin is the brand name for a company called MERZ, M-E-R-Z. They make a botulinum neurotoxin that is called Xeomin. So Xeomin is not another form of Botox, just like Botox is not another form of Xeomin or Dysport or Myoblock. And the same holds true for all these. So it's important that we know that there is a difference between these. And the reason why is because the ingredients are different. How they're stored is different. How the effects on people are different. The amounts given are different. So someone may say they're getting a certain number of units of one of these different brands. That doesn't necessarily equate to another brand and the amount they're getting for that. So they're not interchangeable. So it's important that we know the difference. So the way it works is that the toxin is injected into the muscles that are affected by dystonia, and it is thought to block the neurotransmitter chemicals that tell the body to involuntarily contract and spasm, and those muscles to contract and spasm. So the muscle, it's kind of like putting a roadblock up, which is not really accurate, but that's how I like to visualize it. So the muscles are weakened, and therefore it relaxes or reduces dystonia. At least that is the goal, but it doesn't always work out that way. So not everybody experiences benefit from this. I don't personally experience benefit from this particular approach, so I've had to do other things. Many people are getting amazing results from this, and of course everybody in between as well, which is the case for all treatments. So again, highly variable results from these different things. Now let's talk a little bit about oral medications. The top two treatments for dystonia are botulinum neurotoxin and oral medications. And these four I'll go over real quick as well. So the anticholinergic drugs, like Artane, Conget, and Parsitin, they block a neurotransmitter called acetylcholine, which plays a very important role in muscle activation. Acetylcholine actually is what contracts the muscles. Then there's dopaminergic medications, and they increase the dopamine in the body. Many of us are very familiar with dopamine and have heard of it before. Benzodiazepines, probably the most well-known and probably the most widely used, and they include things like Valium, Clonabin, Ativan, Xanax, etc. They act on what are called GABA A receptors, and I'm not going to go into that, but GABA it stands for gamma aminobutyric acid. It's the brain's natural calming neurotransmitter, and when we're not producing enough of it to calm the nervous system down, these medications act on those receptors to do it synthetically. There's also baclofen, which stimulates a different kind of GABA, GABA B, and again, I'm not going to go into all the details on that. Now, baclofen can be taken orally as a medication, or it can be given to somebody using something called a baclofen pump, which I'm going to go over right now. So there's an intrathecal baclofen pump, and it's a surgical procedure. It's a battery-operated pump that's about the size of a hockey puck, and it's implanted surgically under the skin in the upper trunk, basically in the abdomen, stomach area. So the pump is connected to a tube that delivers the baclofen directly to the spinal fluid at the base of the spine all the way up into the brain stem. So here's a photograph of that. So there's your pump in the stomach, and then the catheter goes from the pump to the base of the spine, and then all the way up, bathing the entire nervous system. I know a lot of people that have had that procedure with great success, and a lot of people that had it and it didn't work so well. Usually that procedure is utilized for people that are taking high doses of baclofen, and they have they've reached the max of oral medications that's allowed, which is I think 80 milligrams. And so when you reach that point, you're tested to see if a baclofen pump, there's various ways of testing to see if you'd respond to the pump. And then you can get it in smaller doses, but directly into the spinal cord, which will provide more relief while getting less medication. So that's an option a lot of people like to try. Now, the more common surgery that we hear about is deep brain stimulation, and that's something that's been used for years now for things like Parkinson's disease, essential tremor, but it was, I forget what year it was approved for dystonia, but it was approved and it's become actually more of a first line treatment than it was in years past. So what it is where you implant electrodes into certain targets in the brain. So a brain mapping procedure is utilized where the doctors, the surgeons, along with the patient, they determine what parts of the brain are causing the involuntary movements. And that's where the electrode is then placed into that, what's called a target. And so the complete apparatus, and again, this is very basic. I'm not getting into the detail of it all, but there's a DBS electrode, a connecting wire, and a pulse generator or stimulator that contains a battery. So here's how it looks. If you see in the brain there are the leads of that stimulator, and then the what's called the extension. That's just the wires that run down into the pulse generator and battery. And some people have it on one side, and some people have it connected on both sides, and they have two pulse generators. There's also selective peripheral denervation, which is only for cervical dystonia. And so selective refers to the care taken to identify which muscles are most affected, and then they are cut. The nerves are actually, the nerve supply is cut to those muscles. And a lot of people have done this with great success as well. So they're all viable options if you're up for this kind of an approach. Then there's myectomy, which is for blepharospasm, and ablation surgery, which is not as commonly used, and that's using a gamma knife or radiation therapy to destroy some of the tissues. It's also used in Parkinson's. Now I'm going to go into the non-allopathic treatments. I'm not going to read all of these here, but all of these different things are and can be utilized for helping with your particular symptoms of dystonia. There are many others as well. And again, like I said in the beginning, I'm not covering every single treatment available to us out there, but I'm trying to cover as many possible ones. Now, some people do well with just one thing, so they may go and get physical therapy or massage therapy, and that's their treatment of choice. Most people I know require a variety of things, be it the medical approach, medications perhaps, along with some of these or several of these. I have found for me and a lot of others that do well in managing them utilize a lot of these different things, and there's even more. So here is a second list of things, and again, this doesn't cover all the gamut of things that you can do or you can try to help. I've written a book that's called Diagnosis Dystonia, Navigating the Journey, and in the book I go over all of the treatments, the medical and the allopathic and non-allopathic treatments. I don't like to call these other ones non-medical because they are medical in many ways. So allopathic, non-allopathic approaches are all described in my book in terms of what they are and what they can do to potentially help you. So if you want to learn about that in more detail, you can go to my book. You can also search the internet for it, but if you want to really get it all in one little place, it's all right there. So you can get that book on my website, tomseaman.com, or on Amazon. So anything really could potentially help. So we have to be open-minded to everything. I have heard stories of things that I never would have thought would have helped somebody, but they did. I'm not going to go into it now, but some pretty wild things that I never thought would be. So it just further opened my mind to anything being possible. So a lot of people ask me, well, you've improved a lot over the years, Tom. What have you done? So I'm going to go through that a little bit right now, but I want to show you some pictures to see. And you saw the first two pictures, the left picture and middle picture before. The picture on the right is me, certainly with a much straighter neck. Here are some other photographs that show kind of the progression of symptoms over the years and the improvement. I am still, despite my neck being much straighter, I have scoliosis, so my spine is actually curved in 3 locations, which actually gives the impression my neck is straighter than it is. I still deal with muscle contractions and spasms. I still deal with pain and balance issues and um, uh, issues with vision and disequilibrium and vertigo and everything I've always had when it was severe, just not as severe as it once was. I fatigue very easily. I have to very much balance activities and rest all day long. Um, Sleeping is very challenging for me because certain body positions can cause actual intense contractions for me. So my body's also been compromised over the years from my body being so, you know, twisted for a long time. So I deal with a lot of, quote unquote collateral damage. But I have improved quite a bit. And that's why I really want to share so much this, because I want to let people know that there's hope and that there are things that could help. So what actually does help me? Medications I take help me. Movement therapy's probably been the most effective for me. I do very specific exercise, stretching, and massage things for dystonia to try and elongate my muscles and also retrain faulty motor programming. So that's my approach that has been most helpful for me. Also use trigger point tools. I do a lot of work with my posture, my core, muscle strengthening. Those are not really dystonia specific, but those help to support the muscles that are helping to support the work I'm doing on my neck to try and keep my neck as straight as possible. But I still have restricted movements and all sorts of stuff that I'm not going to go into right now, but I just want to say that I'm not cured. If even the pictures may show a different story, pictures again, like I said earlier, don't tell the whole story at all whatsoever. So what I feel on the inside is not the same as how it may look on the outside all the time. I also worked on a lot of my mind quite a bit. So I've removed a lot of toxicity from my internal and external environment. So internal referring to, of course, what kind of foods I consume. So nutrition, very important to me. And then my external environment being the people and environments that I involve myself in. I'm very mindful of what overstimulates my senses. People with dystonia, many of them are their nervous systems are a little bit on overload. So we're highly sensitive to a lot of different things. So I have to be mindful of my environments. I've also learned to change my lifestyle to fit the new me. For years, I fought having this condition and I tried to live the life I used to live, which was impossible. I mean, my brain would be like, yeah, do this, do that. And my body's like, what are you kidding me? There's no way in hell you're going to do this, Tom. So I had to learn to work with my dystonia and not fight against it. And as I mentioned before, I need to do a balance of movement and rest. And that's a tricky balance to know just how much without having too much of a kickback. But for me, it's a lifestyle. I've also set up my environment to promote things like good posture. So daily activities and the way we do them are also very important. So the way we eat and sleep, talk on the phone, we sit, how we work at our desks, how we bathe, how we shave, how we do anything and everything can make symptoms worse, keep them as they are, or even actually improve them. So be careful about how you do things throughout the day. I removed and avoid as many stress triggers as possible. And I've set boundaries, and I've done so without guilt or judgment from others. That has, this conditions require me to change a lot of choices I make in my life. And it's my life to live, so I need to live it the way that is best for me so that I can be as functional as possible. That's my goal. I also have a really good attitude and upbeat, but I still have some times when I'm really, really down. But for the most part, I'm very upbeat, even when I'm going through a tough time. I try and look for the opportunities and the obstacles. That's that's kind of the attitude I try and hold on to. And I have a sense of humor about it as well. I've also learned to let go of the things I can no longer do because of my symptoms and fully embrace who I am now and what I can do. So I stopped comparing my life before dystonia, because before dystonia, life was really pretty easy compared to what it is now. So I compare any kind of growth in my life to the person I was at my worst to where I am today. And then I look at the same thing from today until tomorrow. And that's how I measure my growth, not on how life was before this thing totally changed my entire life. And I'm living with chronic pain and all sorts of other nonsense. It's not a fair comparison. So I focus on now, not what once was, and I acknowledge all my efforts and accomplishments that I make every day, no matter what their size is. Also, helping others is very helpful, and that's something that I have really dedicated my life to as a life coach. I work with a lot of people that have dystonia and other health conditions, and I write a lot of articles on a blog, and I make these videos, and just try and spread as much awareness and help and inspiration and hope as I possibly can. And that makes me feel good, which, especially when others makes them feel good, that makes me feel even better. So it's important that part of taking care of ourselves is taking care of others as well. I also take time during the day to decompress. I actually schedule rest time into my day. And I use that time to quiet my mind with meditation, prayer, affirmations, breathing exercises. I shut off the computer on my phone to get those mental breaks. And I love to be out in nature where I feel more grounded. And the world to me is kind of loud. So I like to be away from the noise as much as I possibly can and just tune into my surroundings. Support systems are very important, and I know everybody's support system is different, but hopefully, you have family and friends, and if not, because we do, the dynamics of relationships can change when you have this condition, and so family and friends, the relationships may change or even end. I've lost a lot of friends from this, and some family as well in some cases. So in-person and online support groups with people who know what you're going through are incredibly beneficial. So I encourage you, if you're not involved in one, to please get involved in one. And if you'd like some ideas, you're more than welcome to send me a message, and I'd be happy to help you find something that might be helpful for you in regard to sports groups. A lot of people again ask me, so how do you manage your symptoms? What do you do and everything? And it's a really tough thing to answer. And I didn't even go over all the different details of what I do. So I wrote an article, actually a blog on my website. So if you go to my website, tomseaman.com, click on the blog and you can go to the search bar over on the right and you can just type in my typical day or something like that. And it will come up in the search and you can click on this and you can either read it or listen to what I do on a daily basis and how I go through things, the kind of routine I had to try and keep things balanced as much as possible. What I didn't mention before, though, was I also use a lot of tools for the pain and spasms, and everything on here I use. I'm not going to read them all, so you can pause or come back to this one. But every single thing on here I use pretty much every single day, and for me, it's all about being consistent. Very consistent with what you find to be helpful, and that's been one of the keys for me. And as I mentioned, I've learned to also really manage my stress and my emotions. I also mentioned that I wrote a book called Diagnosis, Dystonia, and Navigating the Journey. If you want to get into the more of the details of what I've talked about, I would encourage you to get this book. It talks about all the forms of dystonia in more detail, coping strategies for pain, anger, fear, depression, anxiety, stress, grief, relationship, shame, all sorts of other things as well with how to deal with the emotional side of this condition as well as the physical side, because that's just as important, if not more so. Also talk about healthy lifestyle strategies, pain management, how to deal with the actual diagnosis and the life changes that may occur. How to make your doctor visits effective, and of course treatments, therapies, and medications. There's a huge section in the book on that. The work environment, which is tough for a lot of people, and the disability process. I give a lot of detailed information about how that all works and how you can utilize that if need be. And I also provide a lot of tips and tricks for doing daily activities with more ease. And that's a key one too. There's a lot of things like sensory tricks people have heard about or antagonistic gestures, but many, many other ways of utilizing different things to make activities a bit more easy. And I, of course, include patient testimonials, quite a few of them actually, so that you can get different perspectives on different topics that are in the book. I've also written a new book that came out last year. It's called Beyond Pain and Suffering, Adapting to Adversity and Life Challenges. This one is not dystonia specific, but it actually in that I don't, talk about dystonia per se, but I talk about a lot of the things the challenges that we have to deal with in life, be it a health challenge or anything else. So this is something else that might be of help to you. Thank you very much for listening. This went a lot longer than I thought it would, but I wanted to really share as much as I possibly could to help you that are searching for some treatments that you may be getting treatments done that might not be helping. You may be brand new to dystonia and not know where to go from here, and what to what to try and what the best things are to manage your symptoms. So hopefully this helped all of you, depending on where you are on your particular journey. If you'd like to contact me with any questions or comments, you can go to my website, which is tomseamancoaching.com, or just tomseaman.com as well. Either one works. You can also put a comment or question below the video. You can also follow me and connect with me on Twitter, Instagram. I'm also on LinkedIn. And if you want to get either of my books, they are on my website and they're also on Amazon. So I'm here if there's anything I can do to clarify or expand upon some of the things in the video. And again, if you have any questions or comments, I'd love to hear from you. Thank you so much, and please be well.